anytime you do range of motion on the neck or pull on the neck, you want to check in with your client if they've had car accidents or any neck injuries. Neck traction feels usually surprisingly good to almost all clients, even if they had an old car accident. Generally, you don't have to be as careful with it as rotating and laterally flexing the head. So I would want to be especially careful if I'm doing these kind of movements to his head. But with traction, I'm going to supportively get behind his head and just pull back towards me. In fact, I can lean with my whole body weight. For most clients, this is going to feel really good, but you still want to check in. Some hints, some very important things to know about being careful with the neck. People often feels uncomfortable to them if you bilaterally reach around the neck too far anteriorly. So if I support behind his neck, I want to be careful where my thumbs are, that I'm not grabbing around too far anteriorly, especially when I'm working bilaterally. And you want to, whenever you have your hands supporting the head, you want to make sure your hands are conveying a soft, strong, confident, supportive, nurturing, I've got the weight of your head sort of messages. You don't want to bobble or bonk or hit or, around the head, or kind of do jerky, sudden movements where they get this feeling like you're, kind of moving around their head and you don't know what they're doing. So you always want to make sure your hands are very supportive and strong and stable. And then when you've got a nice, strong, stable hold on the head, you can start leaning back towards you as if you're lengthening the neck itself and creating more space between the vertebra in the neck. Now you could just go straight into neck traction, but I'm kind of warming up the muscles of the neck a bit. Similar, surprisingly similar to the sort of squeezing movements around the calf that you were doing, although much more careful about the lateral and anterior sides. As I was mentioning about the lateral side of the thumb, the thumb reaching around the lateral side of the neck, there's a big strong muscle that runs from behind the ear on a round prominence called the mastoid process. And this big strong muscle runs across the neck towards the sternoclavicular area. That's called the sternocleidomastoid. And right in that area, the carotid artery passes under. Oftentimes you can even see the pulsing, but if you can't see the pulsing, when you're on it, you can feel it. And so whenever you're working close to that area, you want to make sure that you're not actually pressing directly on the carotid artery. Now, everybody's supportive grasp of the neck and base of the head is going to be a little bit different depending on the size of your hands and the client's head. Some of you with larger hands, you might have to have one hand on top of the other or next to each other. Other people might have their hands more side to side. So just feel the shapes of their head and make sure that your hands are contouring, and play around with different angles to get that support. Now I'm going to slide my hands under, and then I'm going to use the base of my hand to lift up his head and then use my finger grip to pull his head back towards me. So I'm supportively under his head. You can use tiny little rocking movements to get his head up, and then lift from the base of his head to tip his chin backwards a little bit. So we have a little bit of a tilt backwards, or the nose tipping a little bit towards me. At the base of his occiput, where the soft muscles meet the bones, I'm going to supportively get my fingers, and then I'm going to lean backwards. These kind of movements where you're sort of lengthening the spine or pulling on joints in a way where you're actually trying to increase the space of the joints and lengthen the muscles, is kind of like pushing a boat off of a dock, where going with a quick, hard movement, a lot of strength, you kind of just push against resistance, it doesn't work as well. It's like a nice, steady, slow movement. Pushing that boat off the dock, or in this case, pulling it. So I have a pretty strong, firm pressure now with my fingers at the base of his occiput on the muscular part, and I'm just going to lean backwards. If you needed to stand or kneel while you did this, go for it. Or sometimes you can actually use the table, like I'm using my knee to press against the table as I lean back.